President is holding another primetime news conference tonight to discuss healthcare reform. What key points would you like Obama to address?
I would love that health care would not be tied to work, that I think that should be totally separate.
Affordable health care for everyone. Everybody can afford it. There's a lot of people right now who don't have it.
Health care for the elderly, and what his plan is for them.
Premium costs, that would be the main thing as far as low-income families and those without health care, the homeless.
Do you agree with Obama that healthcare reform needs to take place immediately?
It should take place immediately, as fast as possible, but it shouldn't be so fast that we don't know everything that we're getting in the bill.
I think so, as soon as possible.
Why so?
I agree.
Why do you say that?
Because everything is so high and expensive. Nobody can afford their medications.
No. I think healthcare reform probably should be done by an expert panel of medical economists and probably take them a year or two to work out something strategically.
The president says his health care plan won't add to the deficit. Are you confident that will be the case if the bill passes?
I'd have to listen to the particulars. I do follow the news pretty closely, but I'm confident that he wouldn't try to sell us a false bill of goods. If he says that, I know that he really wants it not to add to the deficit.
I think it will add to the deficit, but the numbers I've heard so far, just bailing out the banks, is approaching $24 trillion is the estimate. And, you know, everybody gets all upset because we spend $150 billion or something like that on health care, or $100 billion on health care when we were spending trillions of dollars bailing out the banks. I think our priorities are a little upside down.
No, I'm not. But as I said, that's not really one of my main concerns. I feel like we've gone to deficit for much worse issues.
I don't know for sure. I don't think anyone knows. But hopefully it won't add to the deficit.